Hi, it's Alan. Sorry that's moving. I hope it'll stop moving. Yeah, okay. So, I want to make a video about my upcoming top surgery, which is on August 5th, 2014. Today's the 2nd, so it's in 3 days, slightly less than 3 days. Crazy. Really trippy. So I just wanted to say a little bit about how I feel about it at this point, and also my experience with my pre-op appointment, which was yesterday. Yesterday was Friday, and then my surgery is on Tuesday. Let me talk about the pre-op appointment. So, as I've said before, I'm getting my top surgery with Dr. Curtis Crane in near San Francisco, and also the new doctor at his practice, whom he's training to, I don't know, maybe be like his partner doctor, so that they can serve more trans people, because they're booked like a year in advance. So, as I said before, they're both going to be doing my surgery together. Dr. Crane will be helping to train the other guy further during the surgery, like he's teaching the new guy. I feel confident about this because Dr. Crane will be there. He'll be overseeing and participating in the whole thing, so I'm not worrying about having the new guy there. Okay, so yesterday morning I went to their office north of San Francisco, and I had to wait for a little while because they were running really behind schedule, like they were the last time I was there for my consult. But, you know, they have, like, a shit ton of business, so I guess it's not surprising. So I waited, they took me into the little room, and then a nurse came in along with Dr. Satterwhite, who is the new guy. Dr. Crane actually wasn't there, I didn't see him, so my pre-op was just with the nurse and Dr. Satterwhite, which was fine. The nurse, Katrina, was really nice, really friendly. She was great. She explained the logistics, she explained the risks, you know, stuff that they're, like, legally supposed to talk with me about. And she talked to me a bit about aftercare after the surgery, stuff like that. And then I signed some papers, and she left, and then it was just Dr. Satterwhite in there, so I talked with him about the procedure itself, and I asked him, like, you know, questions that you might want to ask the surgeon before surgery. Talked about which pain medication I want to be prescribed and stuff like that. And first of all, I like Dr. Satterwhite. He is really nice. I really liked that he didn't seem rushed like doctors tend to do. He was very friendly, very respectful. He really seemed like he knew what he was talking about. So he seems like a cool doctor. I approve. So he told me a little bit about his experience. He's had something along the lines of like 8 years of experience doing surgeries, it sounds like, and like plastic surgery. And he told me that he's done top surgery for, like, what's the best term? I don't know, you guys. Like, men born as males, you know? Whatever. So he's done top surgery on those guys who have man boobs, gynecomastia. So it's cool that he's done something like that before. He told me as of this point he has not done any with Dr. Crane yet. So looks like I might be the first or second one or something, which is okay because Dr. Crane will be there participating in it, leading the whole thing. And I also asked Dr. Satterwhite some stuff about the procedure. And, like, one thing I asked was about how they do the nipples, because I don't have gigantic nipples, so I was like, do I have enough material there for them to make the new nipples out of? So he said, yeah, like, it's totally fine because they don't completely deconstruct the entire nipple like I had in my head for whatever reason. They actually just, like, take off the nipple and areola as one piece, keeping it all together, and then they, like, trim the edge off of the areola to make the whole thing have a smaller circumference, you know, just cut around the edge, and then they don't actually cut the nipple itself, meaning they don't, like, chop it off, make it smaller, and sew it back on. They only do that with the areola. He said for the actual nipple, you know, the part that sticks out, they just take out some of the tissue from right underneath the nipple, you know, the tissue that makes it stick out, so then after the surgery, since the nipple won't have the tissue making it stick out, it just gets smushed down, basically. So I didn't know that. That was informative. And, what else? So that kind of sums it up. Yeah, it was a good appointment. And, okay, well, let me know if you have any questions about that, like if any of you are going to Dr. Crane and Dr. Satterwhite. Anyway, so my thoughts and feelings. I'm excited about the surgery, or excited about the results afterward. People keep asking me if I'm nervous. I'm not that nervous, because I feel confident about Dr. Crane, and I've had a surgery before. I had arthroscopic shoulder surgery. That was more minor, but still, it was fine, and I wasn't too nervous when I got that surgery, so hopefully for this one I won't go into it panicking or anything like that. Yeah, I'm just really ready for it. Like, I feel like I would be really disappointed if, for whatever reason, I was not able to get it this Tuesday. I would feel really frustrated and disappointed, because I just feel ready to have it after many years of pondering getting it. So yeah, of course I feel excited about the results afterwards, like, there's an ant. Like, after I heal and can just go out wearing a t-shirt. I mean, that's gonna be awesome. Like, I'm not even bothering to think that much about going around outside without a shirt, because I'm just gonna be super excited, even to simply go outside and wear a shirt without anything under it. That's gonna be amazing. I'm ready for that. One thing that I'm a little bit nervous about is the post-op appointment, which will be 6 days later, when they'll take the binder and the bandages off and I'll see the results. Because, like, it's one thing to see blood and gore, like, on your knee, because people often scrape their knees, that's normal, but I feel like it could be another thing to see blood and cuts and all that on my chest. It might be a little disconcerting to see those big incisions, you know, before they are looking healed and pretty. But I was talking with a friend about this who had surgery with Dr. Crane a little while back, and he said something that sounded like realistic and that made sense to me, which is that, well, for one thing, you might be on pain meds at that point, at the post-op appointment, and also, apparently you are super uncomfortable from wearing that binder that's really tight for a week, so you're like, just get it off of me. I don't care what's under there, I just want it off. I'm just happy to be done with this stage of my surgery process. So I can see how that would happen, and I said to him, it reminds me of what my mom has said about childbirth, which is that when it comes time for the painful part, like, you're so sick of having that baby inside you, making everything, like, inconvenient, making you feel kind of crappy, that you're done. You want it out. Like, you're not even scared because you just want it out. So maybe when I get the bandages off, it'll be like, I'm just so sick of this. I mean, I don't care about seeing blood. I just want to be done with the bandages, so we'll see how that goes. I'll report back when that happens. So, other tidbits about the surgery. My mom will be taking care of me. She's gonna go to the surgery with me, and so we're gonna spend the night in a hotel really close to the surgery place the night before, because I live an hour and a half away, and I don't want to be driving starting at 5 in the morning. So we're going to stay at the hotel, and then we're also going to stay at the hotel the night after the surgery so that I can recover a tiny bit before we do the, well, I guess from there it would be like a 4-hour drive back to where my mom lives, which is where I'm going to be recovering for the first week. Then we'll drive back up north for the post-op appointment, and then I'm pretty sure that I'll be going back with my mom to her house after that, and I'll be there, I don't know, for another week, approximately, to do a little more recovery, because, so this is a change in my plan. My plan was to have my mom help me recover at my own apartment, which is, like I said, an hour and a half away from the surgeons, and then my wife could help me in the evenings when she gets home from work. But on top of all this surgery business, I'm also currently dealing with the fact that my wife and I separated 2 days ago, and we're getting divorced. So that's an insane amount to deal with. That and the surgery, and then I have to go back to work at the end of August, and I have to work on planning the courses that I'm teaching, and I don't know where I'm going to be living next month. Not ideal. Yeah, it's challenging to hang on and keep from freaking out. But at any rate, I'm really glad that my mom is going to take care of me. I know she'll do an excellent job. It'll be really cozy and really comfortable to recover at her house. So, you know, I feel good about what I've got. And you'll notice I'm in a different place than usual right now. And sorry, it's kind of getting darker. Sorry for the bad lighting, but I'm staying in my brother's little trailer because he's out of town. Yeah. So I'm also thankful that I am able to be here at the moment. So, yeah, I'm not gonna get into a lot of detail about what happened with my wife, because it's a very long story, and, like, I don't want to share that with the entire world, but it's not directly because of transition. Like I've said before, she's supportive of my transition. It's just a separate thing. Yeah. But I guess it's sort of related to transition in that, as I just said in my previous video, well, I don't know if I'm going to upload that one first or not, but as I said in my 2 months on T video, transition has really helped me do much better at embracing who I am and noticing and accepting my actual needs, as opposed to what would be convenient for me to want or need. No, you can't live your life well if you just go along with what you want to happen or what would be convenient if it happened. No, you gotta just accept what your needs are, even if they seem crazy at first, even if they're super inconvenient or painful. Things will be better if you just notice and go with what you genuinely need in life. So that's kind of what happened as far as my marriage. Yeah, I feel like I had some needs that weren't totally being met in a deep way. Yeah, I think that's probably all I'll say. But, yeah, so it's a difficult time. Really hard. Really hard. I'm just thankful that I have some supportive people in my life. One other thought about top surgery that I didn't mention before is that it's so trippy to think about the fact that when I go when I go there Tuesday morning is going to be the last time in my life that I will put on a binder or a sports bra. And then when I'm in the office Tuesday morning, when they have me put on the little gown, the hospital gown, that will be the last time in my life that I ever take off a binder or sports bra. I mean, that's so hard to wrap my mind around. That's so huge. And sounds good, for sure. But it's like such a crazy thing. Huh. Yeah. So, anyway, feel free to let me know if you have any questions about any of this, or comments or anything. I don't know when I'll do another video. I don't know if when I'll be on my pain meds, like the couple days after surgery, if I'll be like, yeah, I'm on my pain meds and I feel awesome, I want to make a video. Or if I'll be like, no video. I don't know. But I'll get back to you and update you at some point. Alright, thank you for watching. I hope you are well, viewers. I'll talk to you later. Bye.